Hello, my dear homeopaths. Summer is here, and along with it, we start seeing the same complaints again and again. That is, essay remedies, which will help you quickly think of the most important homeopathic remedies for common summer complaints. In essay diarrhea sub-rubric summer, there are 50 plus remedies of which diarrhea. Let's begin by what Dr. Kent says in his Multi Remedica. Child, coming to next remedies, let's understand what is cholera. Vomiting. Vomiting is not a disease, it is a symptom and can happen due to food poisoning, infections, and indigestion. To vomiting, your key to prescription in cases of vomiting. Hello, my dear homeopaths. Summer is here, and along with it, we start seeing the same complaints again and again. That is diarrhea, vomiting, headache, and weakness. Most people treat this randomly, but in homeopathy the remedy changes with the symptom pattern. So आज के वीडियो में हम देखेंगे ऐसे रेमेडीज which will help you quickly think of the most important homeopathic remedies for common summer complaints in a simple and a practical way. So let's start with the most common complaint, that is diarrhea. जब भी क्लिनिक में डायरिया का केस आता है, we usually think of two remedies, that is arsenic and podophyllum. But is homeopathy limited to such remedies? The answer is big no. If you open repertory, जो बहुत कम स्टूडेंट्स और बिगनर होम्योपैथ्स करते हैं, and refer the chapter rectum, diarrhea, sub-rubric summer, there are 50 plus remedies of which phosphoric acid, camphora, veratramol, nux mosque are high graded remedies but very less prescribed. So let's differentiate this remedy and solve acute cases very easily. Let's begin by what Dr. Kent says in his Multi Remedica. Child with copious watery stool in summer, so copious that the napkin seems of no use. The stool runs all over the floor, forming great puddles. The stool is almost odorless, thin and watery, and the little one smiles as if nothing were the matter. The mother wonders where it all came from, and yet the child seems so well. And the remedy here is phosphoric acid. In phosphoric acid, there is often an amelioration of complaints by their ending in a diarrhea. Now let's take the same child. The stool is very copious and runs all over the floor. The mother wonders where it all comes from, but the stool is so offensive. A horrible stench, and the patient looks as if dying. Here comes the remedy, podophyllum. This is where you have to differentiate in a case between podophyllum and phosphoric acid. Now, before coming to next remedies, let's understand what is cholera. अभी तुम सोचोगे कि डायरिया के रेमेडीज के बीच में ये कोलेरा कहाँ से आ गया. So everything will be linked up once we discuss about cholera in short, and let's recall what is cholera. Cholera is an indeed common problem in summer, particularly in tropical regions where there is endemic, such as India and Bangladesh. The bacteria that causes cholera is Vibrio cholerae, which thrive in warmer water temperatures, making the summer months and the transition to monsoon season is the high risk periods for the outbreaks. Now let's come to the remedy, जहाँ बहुत लोग skip करके already आगे हो गए, I am sure. Now cholera is a disease that brings the patient down quickly. The face is cold, blue and shriveled, without much sweat. In these cases, that one would think of is camphor, what Dr. Kent has mentioned in his Multi Remedica. There is not much of discharge from the bowels, not much vomiting and not much sweat, but suddenly He becomes cold, blue and collapsed, as if it were paralyzed, and goes into a stupor. In such cases, think of camphora. Now, let's compare camphor with cuprum and veratramol. In camphor, there is prostration, blueness, coldness, and yet he wants to be uncovered, and the body is cold and dry. The other two remedies have all there is in cholera, but in cuprum, there is not so much of coldness, but more of the cramping, more convulsive tendency, and not much of prostration. The more the cramping, the more it is likely to be cuprum. The more copious the discharge and the bowels, and the more the profuse the vomiting and the sweat, the more we would think of veratrum. So this is how you differentiate between cuprum, camphor and veratrum. So this was about the diarrhea in summer. The remedies we discussed is phosphoric acid, podophyllum, camphor, cuprum and veratramol. Hence this might have leveled up your knowledge of materia medica just apart from arsenic and podophyllum. Now let's talk about the summer headaches, especially due to heat and dehydration. यहाँ मैं आपको रेमेडीज नहीं बताऊंगा. Instead, I will give you some rubrics which is beautifully given in Boric Materia Medica at the back in the repertory section. So under headache chapter, we have a rubric head pain caused sunlight or heat. We have 11 remedies. Second rubric head pain aggravation sun. We have 10 remedies. Head pain location, that is frontal, occipital, semilateral. Under semilateral we have left sided and right side. Head pain concomitants, that is gastrointestinal derangement. We have 12 remedies in this case. Use this rubric according to the need of the case and prescribe the remedy what matches the best. Don't just prescribe glonine or spigelia. So now coming to vomiting. Vomiting is not a disease. It is a symptom and can happen due to food poisoning, infections and indigestion. Now whenever there is a state of cholera morbus and summer complaints, when vomiting predominates, stools are offensive, watery, foul smell, very prostrating. In such cases, think of bismuth. Vomiting of water, as soon as it reaches the stomach, the food is retained longer, and whenever the patient vomits food and water, think of arsenic in such state. Whenever there is vomiting with weakness, anxiety and thirst for small sips, think of arsenical. And whenever there is severe vomiting with collapse-like weakness, think of veratramol. Always observe, is the patient better or worse after the vomiting, and this will be your key to prescription in cases of vomiting. Concluding this, in homeopathy we don't treat just headache or diarrhea or vomiting. We treat the person's symptom pattern. These remedies are for acute understanding, but proper case taking is always important. Remember, it is not the homeopathy that fails, it is the homeopath that fails to prescribe the exact simillimum. If you have watched this video and gained some knowledge and level up your materia medica knowledge and few part of repertory, then subscribe to our channel and like this video. Thank you.